Well, while the CDC is recommending everyone ages 12 years and older to get an updated COVID-19 booster, there are some health experts that disagree with this guidance.
Dr. Paul Offit, a member of the FDA's Vaccine Advisory Committee, says he's not fully sold on the benefits of the third shot, and he's cautioning healthy young people to hold off on getting the new COVID booster. Dr. Offit joining us this morning from Philadelphia. Nice to have you back on. Good day.
Thank you.
I know that you're not saying this lightly, like don't run out and get the booster, but why are you saying this?
So I think last year, 2021, this was a two-dose vaccine. But then Omicron hit. And when Omicron and the Omicron subvariants hit, those were immune evasive strains. So even if you'd been vaccinated or you'd been naturally infected, you could still get a mild illness. And so the CDC did a series of studies looking to see, did you benefit from a third dose in terms of keeping you out of the hospital, keeping you out of the intensive care unit, because that's the goal. The goal is protect against serious illness. And they found that there was a benefit. And then they showed that to a lesser extent, there was a benefit from a fourth dose. But who benefited? Who were the groups that benefited?
I'm going to say the pharmacy company.
Well, they've been benefiting since December of 2020.
I know. That's what I'm saying.
I think that the groups that benefit primarily were the elderly, people over 75, people in nursing homes. Two is people who had the kind of immune compromising conditions, obviously, and then those who had medical conditions that put them at high risk of COVID, so that even a mild illness could land them in the hospital, like chronic lung disease, chronic heart disease. So I think it's better to focus on those groups. I would say that the other groups, I'm not saying they shouldn't get the vaccine. I'm just saying that they're not going to benefit nearly to the degree that those other groups will benefit.
So, I mean, the efficacy is still up in the air, right? And the side effects, there are some?
Sure, there's side effects with any medical procedure, and there's side effects with this vaccine. Anytime you induce an immune response, you're going to have the products of an immune response, which are fever, muscle ache, joint pain, headache, et cetera, that sort of thing, sure. But I do think that for some, that it clearly is effective. I mean, the CDC did show that for those three groups I just mentioned, a third or fourth dose did benefit. So I think heading into the winter, it's probably reasonable to focus on those groups. I guess I didn't feel so strongly about, say, a healthy 12 to 30-year-old needing to get this vaccine.
For people watching that may not be familiar with you, you were on the FDA Vaccine Advisory Board. You advised the CDC to not really push a booster, but yet they chose not to listen to you when it came to this. So what do you take from that going forward when you're giving your advice on this stuff and the CDC may not choose to listen?
Well, so I'm on an FDA Vaccine Advisory panel. So we advise the FDA in terms of whether we think that vaccine should be released. Remember, the FDA is a regulatory agency. The CDC is an advisory agency, a recommending body. So they're the ones who make the recommendation. The FDA could say, yes, this vaccine can be released as a booster dose, but it's really up to the CDC to say, yes, we recommend it. So it's the CDC and their Advisory Committee for Immunization Practices that makes that decision.
And then in terms of the White House kind of overselling this, maybe there would be a better effort in terms of let's kind of define who needs this most. But why would they go with this blanket statement that everyone should get it?
I think that their thinking is that the more people that get the vaccine, the less incidence of disease you're going to see out there. But, you know, the fact is that even if the entire world were vaccinated, and even if this virus never created variants, it's a short incubation period in mucosal infection. It's going to continue to circulate. It's going to continue to cause mild disease. And in some, it's going to cause severe disease. So focus on those people. I think the notion of sort of trying to vaccinate as much as we can and as frequently as we can to try and decrease transmission, decrease mild disease, I just don't think that's a viable public health strategy. I don't think it would work.
So let me ask you something. I mean, you've been in, for boosters for kids and kids getting the vaccine. What changed your mind about this booster shot and why you don't think they should get it?
Well, I think children should be vaccinated, and they should get the primary series, certainly. The thing is, though, remember that for those, especially males, less than 30 years of age, there is that rare but real risk of myocarditis, which is inflammation of the heart muscle. So don't take that lightly. And I think that when the benefits are clear, and I think certainly for high-risk groups, so for example, a 15-year-old who has chronic lung disease, I think that person could benefit from a boost. But an otherwise, frankly, healthy person, less than 65 years of age, I don't think it's going to benefit. And so if the benefits aren't clear, then the risks become a little more important. So that's
interesting. So just say like somebody you know has had the two vaccines, one booster, and COVID once that she knows about, asking for a friend. Would you suggests that she gets this booster.
Which friend is this?
Well, that's actually my story. I've had 3 doses of the vaccine and 1 mild infection. I'm not planning on getting the booster because I think what I had is I had excellent protection against serious disease. I mean, when I go out I've had 3 doses and a mild infection and I'm asymptomatic, I think the chance that I'm excreting the virus is 0. So I don't think I'm going to harm to anybody else.
Yeah.
So then the question is, if I'm going to go out, let's say go to a grocery store without a mask, am I going to be at risk of being exposed to the virus? Yes. But I think I would have at most a mild illness, which I think I'm going to have to be willing to take over the next few years or decades, given that this virus is going to continue to circulate.
Right.
What about people that have coded 3 times?
I think you get a free pizza.
She wins.
Where's the pie at?
She wins.
Oh, boy.
Dr.
All right.
Paul Offit, always great to talk to you. Thank you so much for your advice this morning and sharing your concerns. We appreciate it.
My pleasure.